welcome to Synergy's Q&A Wednesday, and I am Emily Ashley. Today we've got Dr. Diana Doty. She's a chiropractor on staff here. And whenever I first got an adjustment from you, Diana, it was very different than what I experienced before, and it surprised me. And I think that it would surprise other people too. So if you could talk a little bit about what you do. What is your technique?
Sure. I focus on posture correction.
We're a little giggly today, sorry.
I focus on the global posture. So when you go to a chiropractor, they're working with the vertebra, the bones of the spine, right? And when they work with the vertebra, basically chiropractic will correct a misalignment between one vertebra over another. With posture correction techniques, we look more at the global posture of the spine. So your relationship of your head to your torso, to your pelvis, to your feet, and how your body's moving together and how it's working together. So we're going to use different techniques to realign the global posture, including vibration therapy, balance therapies, weighting, and the arthrostem adjusting technique, which is, I think, what was so different about my technique from others that you may have experienced or heard about before. The reason that I like using the arthrostem is because, A, it gets the bone into the right place, and that's actually been demonstrated on x-rays. And so it's a very effective tool, but also it's a very comfortable tool as well. The arthrostem looks like this, and it's faster than a human can move. So it allows me to adjust the bones with less force, less intensity, and also it will allow me to adjust you without getting you into strange positions. So for many people who are uncomfortable with having their back turned or who are unable to lay down, this can be a really effective adjustment for them without them having to assume any particular position. I can adjust them standing, seated, or laying down, whichever. With the instrument, what you're going to feel is basically it's going to tap on your bones, and it's going to tap as hard as I need it to in order to feel the motion of your joints.
I can feel it all throughout my arm.
Exactly. So I can feel it throughout my arm too. So it's not a machine adjusting you, it's me adjusting you with assistance.
That's cool. The first time that I ever got adjusted by you, Diana, I felt like somebody had just lifted the window of my brain, and I didn't even realize until after I got adjusted that I wasn't thinking clearly. And after you adjusted me, a light bulb went on, and I could think and process things much more clear.
Yeah, you hear a lot of chiropractors talk about the upper cervical spine, the top bones in the spine, and how those are the most important bones in the body to have in alignment in order to have health and wellness in your life. Pretty much with the digital motion x-ray and the motion analysis, so we're getting a video of your bones moving in real time, we can see the tiny damage to ligaments that life, car accidents, falling off horses, falling off bicycles, any kind of small injuries might have built up over time in the upper cervical spine. And I can actually use the arthrostem to put those back into alignment. And when those are in alignment, people get bizarre results. Not just relief from neck pain and headaches like you expect with a chiropractic adjustment, but I've also had patients experience clearer thinking, better hearing, better vision, better motivation, better moods, just from having adjustments in the upper neck. So it's not what I expect, but at the same time, the methods that we use are very safe and very modern.
Non-invasive.
Exactly. Yeah. It's worth a try to see if it works.
Chiropractic is so cool.